Hello, 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 and welcome to another episode of Wellness Wednesday with Dr. Latoya Wells. I just wanted to take a moment to welcome you to another episode of Wellness Wednesday. It is such a pleasure to be with you all each and every Wednesday for hot topics related to health. This week, we are going to discuss a few different things. I was going back looking at our previous lives from last year, July 2024, and there's more of the same. I'm like, we're still dealing with some of the same things, but some things are new, some things remain the same. Just show up with some different things. I am Dr. Latoya Wells, Doctor of Nursing Practice, family nurse practitioner, and owner of Wells Legacy Health and Wellness. We are a full service family practice office clinic provider, and I am excited about what is to come for my practice. I'm excited about my new patients and all of the individuals that I have made connections with. For my patients, I appreciate you for trusting me with your healthcare needs. For those that I have interacted with via social media, thank you so much for your support and your feedback and your continued existence here with Wellness Wednesdays and just your presence. I appreciate it. We are located at 452 Osceola Street, Suite 106 and 107. You can find us on Facebook, Instagram, TikTok, YouTube. Our number is 321-306-6755. Our website is wellslegacyhealth.com, where you can check us out to see what services we offer and to also book an appointment. We're going to jump into it. Thank you again for being here. So what's going on? I've been hearing from colleagues, from friends, and just family members, like, we're still dealing with sicknesses. There's things still happening. What is going on? What's up in the healthcare world? What's going on? What's out in our community right now? And if I were to go back and replay my live from last year, July, when we were talking about what's going on health wise, some of the same thing. So we still have the flu. Influenza is still here. It's still around. COVID is still here. It's still around. RSV is still here. It's still around. And we have this new strain of something that's out here. It's upper respiratory. It has symptoms very similar to flu, COVID, and RSV. However, when individuals are being tested, none of these things are coming up as positive. So we know the flu, right? Signs and symptoms, you got the fever, the cough, the sore throat, the body aches, and fatigue. There are two strands of the flu. You got flu A and flu B. The symptoms can vary a little bit with that, but the way to find out what strand you have is to go and get tested. So if you're not feeling well and you're not sure what's going on, go and get tested. And I apologize for the noise in the background if you guys hear any noise. I am traveling and I'm very close to an airport. So you might hear an airplane fly over the hotel. So I apologize in advance for that. And I have my fur babies in the other room. So if you hear them, they just want their presence made known. And you may see my husband pop in and pop out. So but want to get that out of the way. The key to staying healthy, and we'll talk about that a little bit, but I just wanted to dive into some of the things that we're seeing going on. The flu, A and B. Someone asked me, is it possible to have both A and B at the same time when we're thinking of the flu? Yes, it is very possible for individuals to be positive for both flu A and B. Some of the things that you can do is, one, good hygiene, getting good rest, making sure that you're avoiding close contact with individuals that are sick, and getting vaccinated. With the temperatures being extremely high, we're seeing heat indexes in the hundreds, right? And so people are staying inside more, which is causing an uptick and an increase in some of these viruses because individuals are sick, they're staying home, individuals are more congregated than before, and we're seeing an increase in these viruses. And so, again, getting vaccinated, making sure that you are practicing good hand hygiene. You're washing your hands. You're avoiding contact with individuals who are sick. You're not touching surfaces and then touching your mouth or your eyes, things of that nature. Just some of the common things that we do to make sure that we're staying healthy: eating well, drinking plenty of fluids, getting rest. RSV, we talked about this before. It's a cold like presents with cold-like symptoms, severe in younger children and older adults. There is a vaccination for RSV right now. We don't tend to see RSV as much during the summer. However, this year we are seeing an increase in numbers of individuals being diagnosed with RSV. Typically, we see it in the fall and the winter months. However, we're seeing increases during the summer months, again, because the temperatures are hot. Individuals are around each other more often, and so we are seeing, increase in the number of individuals being diagnosed with RSV. Keep in mind that RSV can impact smaller children and babies and the elderly more severely than other individuals. So let's just be mindful of that. COVID is still here. COVID has not gone anywhere. It's still here. I was reading an article just last week about COVID and how we're seeing a resurgence of COVID cases. And it's not that COVID ever went away and now it's just all of a sudden popping back up on the scene. It's been here all along. It's just that you'll see the numbers of individuals who are testing positive for COVID wax and wane, right? So you'll see not too many, and then all of a sudden we'll see a rush. If you think about it, Florida is one of the travel destinations. And so you have people during different times of the year, primarily the summer, you have individuals traveling in from all over the world into Florida, and people from Florida traveling all over the world to get out of Florida, right? And so because of the increase in travel during the summer months, we tend to see an increase in all of these viruses, but COVID is still here. Some of the signs and symptoms of COVID, again, is the fever, the cough, the shortness of breath, the loss of taste and smell. Yes, we are still having individuals who are presenting COVID who have a loss of taste and smell, sore throat, GI symptoms, nausea, vomiting, what have you. And so because some of these symptoms of all the three that I just mentioned are pretty similar, some individuals may think, oh, I just have the flu. Well, no, they have COVID. And so we need to make sure that we are getting individuals tested and that we are quarantining and doing what we need to do. Masking, vaccinations, social distancing are all things that are recommended. Of course, follow your recommendations of the areas that you live in, but let's do what we can to make sure that we're staying healthy, right? And again, as I mentioned, there's this other respiratory virus that is going around that's not COVID, it's not RSV, and it's not the flu, and it's not the common cold. So let's just make sure that we're doing what we need to do to stay healthy. On that note, some tips that we can utilize to make sure that we're staying healthy. One, you want to make sure that you're getting plenty of rest. Individuals who are sleep deprived, who are tired, who are dealing with extreme exhaustion tend to place themselves at a higher risk for contracting many different viruses and many different things. When you're not healthy, when you're not well rested, your immune system suffers from that, and you place yourself at higher risk for catching some of these different things. So good health habits, again, balanced diet, make sure that you're staying physically active, you're managing your stress, again, sleep as much as you can, all help to make sure that our immune systems are healthy. You want to make sure that you're avoiding close contact with other individuals. Again, it is the summer months. We are out and about. We're, as I said, we're in the streets, right? We in these streets. Limit close contact with individuals who are sick. So if you're around someone and they're sick, you want to make sure that you are doing what you can do. So again, wearing the mask. Some people are against masks, and I'm not pushing it on any person. You do what you feel is right for you. But let's just make sure that we're doing what we can do to keep ourselves healthy as well as other individuals. So, washing your hands. If you're sick, not going out. Don't be in the streets. Don't go to work. Don't go to school. Don't go to the store. Stay home. We have so many things now and so many services and amenities and things that we can do to prevent from going outside if we don't have to make sure that we are not around individuals when we are sick. We have Uber Eats, we have DoorDash, you got all these places where you can have them deliver your food directly to you, your groceries and things of that nature to you, so you don't have to go out. If you need to go outside, go sit on your porch and get some, some fresh air. You can walk outside in your driveway, what have you. But let's just make sure that we're not going out making other individuals sick. We still have individuals in community who their immune systems are weakened, and they're at a higher risk for developing major complications. So again, just some simple etiquette when you're sick. If you're coughing, make sure you're covering your cough. If you're sneezing, make sure you're covering your sneezing, the elbow sneeze, and using the tissues to cover the cough. And make sure that you're discarding those tissues, those soiled tissues or used tissues in the trash can. Make sure you're washing your hands frequently and properly, right? The ABC song, wet your hands, lather it really good, and then make sure you're washing your hands for a good amount of time. And then, of course, using sanitizers. 20 seconds at least when washing your hands. When I would educate the little kids in elementary school, the kindergartners, the first, second, third graders, about hand hygiene and how I would use the black light I would use the powder, the glow in dark powder, where we would kind of go around touching each other and, shaking hands and touching different things in the room. And then we use the black light to highlight that, to show just how quickly we can spread germs that we don't necessarily see. And so teaching them how to properly wash their hands, soap and water, for at least 20 seconds, okay? And especially after you've been touching different things, you're eating, you want to wash your hands before you eat, all those things. And these are things that I taught the little kids, right? But even more so now, we got to make sure everybody is reminded of that. And then just making sure you're eating right, eating healthy, getting plenty of rest, drinking plenty of fluids, water. You want to make sure you're staying hydrated. And then if you're an individual who get your regular vaccines, make sure that you are talking with your healthcare provider about getting the flu vaccine and the COVID vaccine. And again, there is a vaccine now for RSV that individuals can also receive. So just making sure you're staying up to date on what's available for you. I talked about the heat and how the heat indexes and the feel like temperatures are extremely high. I don't know about you guys, but my AC has been running overtime because it's been so hot. And so I want to make sure that we are doing what we can to, one, make sure that we are protecting ourselves from the extreme heat, and that we're staying hydrated and we're doing everything that we can to, one, make sure that we're avoiding, some of these heat related conditions. We talked last year about heat exhaustion and heat stroke and things of that nature, and it's still a concern, especially when the heat and the temperatures begin to increase. And we are, of course, as I mentioned, we're outside, we're at the beaches, we're, doing different things, and we're putting ourselves at risk if we're not taking the right precautions. And so I want to make sure that we talk about that a little bit. So heat exhaustion occurs when your body overheats. Symptoms may include heavy sweating, weakness, dizziness, nausea, headache, and fainting. Heat stroke is more severe, and this is where your body temperature reaches above 104 degrees Fahrenheit. So heat exhaustion is bad enough. But when we get to the point of heat stroke, it means that we either did not listen to our bodies, or we failed to recognize the symptoms that were occurring. And heat exhaustion has now gone to a point where our body is not able to regulate the temperature. And so typically when you get hot, you sweat, right? And that's your body's way of trying to cool you down. However, when an individual progresses from heat exhaustion into a heat stroke, their bodies are not able to regulate their temperature. And so you'll begin to see the temperature, the internal temperature will increase at above 104 degrees. And the symptoms include confusion, agitation, hot and dry skin. Again, there's no sweating, rapid heartbeat, and potentially these individuals can become unconscious. And a heat stroke, as we talked about last year, is a medical emergency. So we're getting into the rainy season right now, so it's raining more frequently. However, the temperatures are still really high. So making sure that you're staying hydrated, drink plenty of fluids throughout the day, even if you don't feel thirsty. And last year, someone pointed out, when you feel thirsty, it's almost too late, because at that point, your body is sending signals to you. Hey, we haven't had anything to drink, or we have not had enough to drink. And so what's the average amount of water we should be taking in? And so there's different things, calculations, but I say half your body in ounces in water per day, half your body weight in ounces of water per day. Right? We want to make sure that we're avoiding alcohol and caffeine. And so, because alcohol and caffeine can contribute to dehydration. And if you are someone who has to have a soda or a pop or whatever you call it, or you got to have your coffee or your caffeinated drinks, just teas and things of that nature, my rule of thumb is for every soda that you drink, you're also drinking a glass of water or a bottle of water. Okay, so let's just make sure that we are staying hydrated. Someone asked me about the sports drinks, the Gatorades, the Propel, and things like that. Those can help because many of those have electrolytes in there, and it has the sodium, which when we're hot and we're sweating a lot, we are getting rid of sodium. And so if I don't know about you, if you've been sweating and sweat gets in your mouth, it's salty. And that's because our bodies are ridding itself of sodium. And so those sports drinks and things of that nature can replace those electrolytes that you're losing with sweating. There's also IV hydration right now that's been offered many different places, and many practitioners are providing that as a service, and soon we'll have that. But if you feel that you need that, it's available for you, and I would recommend that you check it out. I've had it several times and it's worked wonders for me. So stay cool and staying inside. So if we know that the temperature is going to be hot, typically late morning, early evening, stay indoors during those times. Do activities or choose activities where you'll be inside, walking around the mall, the library, the things of that nature, somewhere that you're indoors during the hottest periods of the day. It's not a good idea, and I'm talking to myself, to go and try and cut the weeds or deal with the weeds or de-weed the garden at 12 o'clock. Or go take a walk at 12 o'clock when the sun is beaming hot. And so we got to just be smart about that. Use air conditioning if possible. I see a lot of people with the fans, and they're carrying around their little fans. Just making sure you're having different things that can help cool you down. And make sure you're dressing appropriately, wearing the lightweight, light colored clothing, loose fitting clothing. And then also make sure that you are using your sunscreen. Recently, there was a situation that kind of hit close to home within the last year or so. There's someone that I know who was diagnosed with skin cancer, and there was a resurgence of that skin cancer. And so they're looking at having to go through surgery again. And they are African American. We also can get skin cancer. Us who are heavily melanated, darker skinned individuals can also get skin cancer. It is not particular to one race. We're all at risk for developing skin cancer. Some individuals are at higher risk because of their skin and, you know, the lack of certain qualities in their skin. But we all are at risk for developing skin cancer. So make sure that you are wearing your sunscreen. Read the instructions on how frequently you need to put it on. It's not a one and done. Some you have to apply every hour, some every 2 hours, what have you. SPF of 30 or above is recommended. So just make sure that we are being cautious and that you are doing everything that you can to protect yourself. So limit outdoor activities, as I just mentioned. Schedule those activities around the cooler parts of the day if you have to be out. So early morning or late evening. And make sure that you're taking breaks in the shade or in an air-conditioned area if you must be outside. So some ways to, apart from going inside, using cool compresses and taking cold showers or baths, having the fans. There's these, I remember one year when there was a hurricane and there was a nursing home who was without power. And there were some practitioners who were kind of going in helping those individuals. And they got these cool towels that you can put around the neck that you could dip them in cold water and it would provide a source of cool to help keep those individuals in the nursing homes cool. And so just different things that you can find that may be helpful for you. I would recommend those things. Monitoring high-risk individuals, so the elderly individuals, the young children, individuals who have chronic medical conditions, making sure we're checking in on them. Believe it or not, there's individuals who do not have central air and heat in their homes. And so if we have our older neighbors, you know, who don't have running AC, and, you know, it might get hot in their homes, let's check in on those. Knowing the signs, so know what to look for. Be aware of the signs of heat-related illnesses and being able to take actions, not just for yourself, but for someone else. So if you're around someone, make sure you know what heat exhaustion looks like. Make sure you understand the signs and symptoms of what heat stroke looks like. So if you pick up on those signs, then you can react quickly to get those individuals or even yourself the help that you need. Pets and children, and we shouldn't have to say this, but every year, and I don't think that I've heard many of these cases this year, but I'm sure if I were to do some research, there are some cases of children and pets being left in hot cars. Even for a few minutes, the temperature within the cars can get upwards of 120 degrees. And so we want to make sure that we're not leaving children and pets in cars. We had a rental car a couple of years back, or maybe about a year or so ago. And before you get out the car, there's a audible sound that tells you to check the back seat and to make sure that you are checking if you have little kids or you have pets. Emergency, what to do in an emergency. So if you expect someone is having a heat stroke, their body temperature is high, they have an altered mental status, they're confused, they are not sweating, they may have some vomiting or nausea, and then their heart rate is elevated. You want to call 911 immediately, and you want to take the steps to get that individual cooled down as possible. If you have ice around, you have cold water around, make sure you get them, you know, saturated with cold water. Make sure that you have the ice that you can put on them, because the quicker we can get their body temperature down, the better the chances are for these individuals. Next thing I want to talk about is hurricane preparedness. We just had our first named hurricane that really went through many different areas, Hurricane Beryl, and I believe that's how you pronounce it. And so right now in Houston, there are many individuals and several other places who are without power, and it's hot. So we have to, stay informed. So make sure, I'm not someone that watches TV all the time. And so I have alerts that come on my phone that will keep me in the know of what's going on. So make sure that you sign up for weather alert, or if you are an individual who pays attention to the news, keep track of what's going on in your area. Make sure that you're preparing and that you have a evacuation plan and what you're going to do and what your family is going to do in the event that a hurricane comes your way. So know your evacuation plan, know how to get out of your area, know what you're going to do, and that everyone in your household has knowledge of the plan. So communication, how are you going to communicate with others? Who are your emergency contacts? Where's the designated meeting place? Make sure you have your emergency kit available. Water. So the standard is, or the general rule is, 1 gallon per person per day. Make sure that you have the non-perishable foods. Make sure you have medication at least enough for 14 days. Your flashlights, your batteries, cash on hand, because many times the ATMs are not working, and that you have important documents and a first aid kit. For the important documents, and when I worked in hospice, one of the things that we would have individuals to do is to take important documents and put it in a Ziploc bag and put it in the refrigerator, because EMS is going to come and they know to look on the refrigerator or in the refrigerator for those important documents. So make sure you have your important documents in a waterproof bag or something where they won't get damaged. Make sure you're securing the windows and doors. Do what you need to do. If you have storm shutters, I was walking through my neighborhood, and there's a few individuals who had some storm shutters on their windows. Trim the trees ahead of time. I don't know about you guys, but in my neighborhood, we have some huge oak trees. And so make sure that you're trimming your trees and you're doing what you can do to make sure that your home and your property is ready for the hurricanes that are to come. It's inevitable. We live in Florida, and this is the area where we deal with hurricanes. Making sure that you're securing and removing all the things from outdoors, furniture, decorations, anything that could become a projectile with strong winds and that could potentially hurt someone. And again, just making sure that you are staying alert, that you're reviewing your plan, that you are staying attentive to what's going on. And then if you are hit by a hurricane, what to do afterwards. Just be mindful, charge the cell phones, things of that nature, to make sure that everyone in your area and your surrounding neighborhood and in your family is well. Check your home for damage. Stay indoors until it's safe to venture out. Many times there's individuals who are hurt or either lose their life after a hurricane because they go out and there's down power lines, there's different hazards, and they end up hurting themselves or getting injured. So just make sure that you are being safe, that you're doing what you need to do to take care of your health during this time. There's so much going on, and there's so many individuals being impacted by so many different things. So let's just make sure that we are staying safe, that we're taking care of our family, that we're being vigilant, and that we're reaching out to individuals who might need help during this time. So again, this is Dr. Latoya Wells with Wells Legacy Health and Wellness. I hope that you guys can see me and hear me okay. And I just wanted to come in and highlight a few things that I felt were important during this time. So stay safe and be well. I will be with you guys again next Wednesday. I will be in my home office or even in the office, the clinic, Wells Legacy Health and Wellness next week. But take care of yourself, stay safe and be well. Until next time, I will talk with you soon. Bye.